Hello, I'm Shane Smith. I'm the Food Protection and Facilities branch head for the Environmental Health section within the Department of Health and Human Services. A little bit of background about me. I have over 21 years of experience in environmental health. I started at the local level at Wayne County Environmental Health Department before becoming a regional specialist. And I've been branch head for the Food Protection and Facilities branch for over 6 years now. It's my pleasure today to introduce you to the public health impact of food safety. We will go over a little bit of our history of where food safety came from, also a little bit of our regulatory framework, and some interesting tidbits of where we go and how you can be involved in food safety and our regulatory process. So topics of discussion for today's presentation will be the history of food safety and where our rules came from, the effects of foodborne illness, not only on our facilities, but also on our regulatory framework, changing effects of foodborne illness, the cost of foodborne illness and its impacts, food protection today, and what can you do as an environmental health specialist that is entering the field to be part of the process for helping educate and not only that, be part of our rulemaking process. So let's first look at where our first known food safety rules and our first steps in the evolution of food inspections came from. First, we have to look at England in 1202. This was our first known recorded history of a food rule put in place. And this wasn't actually for a food safety process as far as reducing incidents of bacteria or disease or trying to limit those foodborne outbreaks. It's actually a food adulteration law that would not allow peas, or beans being added to bread so the product would weigh more and so it would be more profitable for the bakers. Our next discovery that includes what we use in our work today would be results of hand washing. A Hungarian doctor discovered that washing hands with soap and water increased the mother's chance of surviving childbirth. It also led to the first discovery of hand antiseptics, and this was started to be used primarily in the medical field, but also made its way to food safety. Lastly, let's look at the late 19th century. There was a relationship that was drawn between bacteria and disease. And if you think about your studies in college, this was conscious postulate that formed a link between more prevalence of bacteria equal to higher chance of contracting disease. So here in the United States, the first known agency that was founded was by President Abraham Lincoln. He founded the Bureau of Chemistry, which later became changed to today's FDA and the USDA department. In 1885, a veterinarian that worked for the USDA, Dr. Daniel Salmon, found a bacteria that caused foodborne illness, which later became named after him, which is Salmonella. The first known epidemiological study was a case in the northeastern part of the United States by an environmental health specialist. It was a case where several cases of typhoid were breaking out across the Northeast, trying to track down what the culprit was. There was a cook that was taking different jobs throughout different houses and homes throughout that area, changing their name to different aliases, and she was an asymptomatic spreader of typhoid, and this was the first known epidemiological study, and the case was famous and made by this name of Typhoid Mary. Lastly, the book The Jungle by Upton Sinclair was a book that was produced in 1906. It was made to want to shed light on the plight of immigrant workers working in the meatpacking industry and cause sympathy to try to change some of the plight for those workers. But what it did was also point out to the unbearable conditions and how meat was handled, how meat was processed, and led to our first food rules in the United States. Next, let's look at the three main types of foodborne diseases and hazards that we try to combat with our food inspections and our risk-based inspection process. The three main types are microbial, chemical, and physical. Examples of microbial include bacterial. This would be E. coli, Salmonella, viral, which would be the most prominent foodborne illness that we find being reported today, which is norovirus. Parasitic, and a good example of that would be trichinosis that is found in pork. Chemical, different types of antibiotics that can contaminate the food. Also carcinogens, which is naturally occurring dioxins, and heavy metals such as lead or mercury. Lastly, physical contaminants. Think about allergens, the more prevalent allergies we see today: peanut allergies, shellfish allergies, milk allergies, but also prions. Prions are non-folded proteins that actually can cause such illnesses as hydroencephalitis. Our next slide shows several foodborne illnesses and foodborne pathogens that you may be familiar with, but were not discovered prior to 1977. They include, as I discussed previously, the leading cause of foodborne illness today, which is norovirus, but also other foodborne illnesses such as Campylobacter, Salmonella enteritidis, Vibrio vinificus, also Shiga toxin producing E. coli. As well as their spongy encephalitis, which we discussed a little bit earlier, which were causes developed by foodborne pathogens from prions. Some of the challenges that we face in trying to protect our food safety system include the list on this slide. It includes a change in consumer expectations, as we as consumers expect to be able to purchase and eat any type of fruit, vegetable, or meat, no matter where it comes from, at the drop of a hat, depending on where you want to go from a grocery store or out to eat at a restaurant. There's an expectation to be able to have all different types of fruits and vegetables at our choices. The next would be changes in farming and manufacturing to try to keep up with the food safety and food supply demand, the increased globalization across the world, our shifting demographics, moving to more of a highly susceptible population in our demographics. I'll discuss that here in a little bit. Our outdated infrastructure, how food is transported across the world and across the globe to get to where they need to be sold and purchased to become part of our food system. Food terrorism, the deliberate intake of trying to contaminate our food system, and then our changes in tracking the food supply as it goes through a wide distribution net. This slide is a snapshot of how quickly things have changed in our distribution of food around the world. You can look at back in 1850, how long it took for food to circumvent the globe to now an increased population and a quicker demand, and also a quicker process and a quicker response of how food is shipped and distributed to our different communities, no matter where you are. A few slides back, you heard me discuss the shift in our demographics around the world. And basically what that means is we're increasing to an aging population. If you look at the different timestamps here, this is the percent of over 60 years in our population. In 1980, it was only 15%. In 2005, it jumped minor to 17%. But in the next decades or so, you've moved from 20 to 25%, which is expected to hit us soon here in the year 2025. Currently, 20 to 25% of the population is in this high-risk category, meaning that this is a highly susceptible population. This includes young, under 6 years or younger, older, over 60, pregnant, or immune compromised. This means that if you do contract a foodborne illness, you are more highly susceptible to be able to contract that, and it could be more serious than it would be someone that is not in this demographic. Every day here in the United States, we import goods from all across the globe. This slide shows a breakdown of our importation of these goods, and you'll see that the largest majority that we import would be our food supply. It dwarfs the combined categories of devices for radiological health, biologics, animal and drugs and feed, human drugs, and cosmetics, as it becomes more and more increased of an imported food supply here. So let's take a look at the effects of foodborne illness here in the United States. Each year, there is a reported over 48 million outbreaking cases of foodborne illness. Take in mind that this is more than one reported cases from one incidence that results in an outbreak. That leads to 127,000 hospitalizations, over 3,000 deaths each year, and an uncalculated number of outbreak investigations that includes working within those food facilities where have been pinpointed, or food processing facilities. This has a monetary impact for those that are being sick, impact to our wellness system, our healthcare system, the businesses themselves, loss of revenue, but also it includes a large mental toll for those that are working the cases and those that are involved in becoming sick in the business themselves, of trying to reduce that impact for a foodborne illness and make sure no one else gets sick. The total economic cost of foodborne illness here in the United States ranges between $10 and $83 billion each year. This includes the pain and suffering for the victims that have become exposed and contract foodborne illness, the reduced productivity for the businesses that have been pinpointed and affected, but also the medical cost for those that have become sick to try to combat those symptoms, to get them well, and to reduce the financial burden for all involved. There are several different agencies that lead our food safety response here in North Carolina. First, let's look at the Department of Agriculture. It has two main breakups within their reporting structure. One is the Food and Drug Protection side, which is responsible for the inspections of all food manufacturing facilities. This does wholesale food operations, also food that's being packaged and sold at our retail outlets. This includes seafood markets, but also our meat and poultry side within the Department of Agriculture. They enforce state and federal laws to help keep our meat and poultry production safe. This is the processing side of that, make sure it's wholesome, unadulterated, properly labeled. These inspectors are at these processing facilities daily to inspect every product that comes through the assembly line before it is shipped out to retail and for wholesale sale. Our next slide shows a sample of a jurisdiction chart that is shared between the Department of Agriculture and North Carolina Department of Health and Human Services. We meet with them quarterly to discuss different products that need to be regulated in our states, to decide where it falls between the jurisdiction lines. Some products are shared. Some products are given to certain agencies with a MOU or a memo of understanding, depending on if that inspection process is already being done for that facility. We meet with them quarterly to discuss these new products that are being developed and are being produced in our industry, to make sure the right agency is regulating and inspecting that product. Also, we have this on our website, so you can look at that once you get questions from new producers or from agencies within your county to see who needs to regulate this type of product. As far as the North Carolina Department of Health and Human Services and our local health departments, our administrative code is where we have our rules that are designated for food safety inspections. Here we've incorporated the 2017 FDA Food Code as the basis of our rules. The FDA Food Code is updated every 4 years, and it is based on a risk-based inspection process. It includes reducing the risk factors that are known processes for causing a foodborne illness. These include improper holding temperatures, inadequate cooking temperatures, contaminated equipment, food from unsafe sources, and poor personal hygiene. Here in North Carolina, we must have a legislative authority to adopt new versions of the Food Code. The Food Code provides a uniform and up-to-date code, and it also helps all industry officials, whether you're industry, regulatory, or local health department regulatory, to speak one common voice, one common language. It also is adopted based on the most current science. This is a process that is taken for the Conference of Food Protection to look at how any changes or any updated science may change the basic formation of the rules. It stays current. As you heard me discuss in the previous slide, it is updated every 4 years. And not only is this just the rules basis, but it gives also regulatory agencies guidance documents, posters, and educational information that is developed that can be shared to help reduce incidence of foodborne illness. And is used as a basis for all regulation in most states. So what can you do to help reduce foodborne illness as a new environmental health professional entering into the food safety world? First thing you do is never stop learning. Of course, there is a requirement for continuing education hours that you will report each year as an REHS, but there's always classes that are being offered by the state. Also, our North Carolina State of Practice offers plenty of updated classes, as well as FDA. For the continuing knowledge, the more you become knowledgeable as far as to be able to help reduce foodborne illness and our increased effectiveness of checking risk factors, the more you'll help your local community and the more you'll help your local business to stay safe. Also be an educator and not just a regulator. Of course, part of what we do is reporting our findings with our inspection reports, our grade cards that we post, but also be able to educate once you see those incidents that could cause foodborne illness or those risk factors that are being marked on your inspection forms. The more you can educate to try to reduce that on the local level, the safer your community will become and the safer our state will be. Always identify and solve problems, whether it's when someone's bringing you a brand new plan review, trying to open up a restaurant, or an idea they have for a new product, or it could be a process they are already in the field utilizing and you see where it could cause a problem down the road. Identify those problems, solve those problems, and educate, as we discussed just a minute ago, to work with our food safety partners. Promote food safety. You'll get plenty of opportunities to speak at local civic organizations, at schools, to speak at conferences, any chance you can to be able to broaden the scope of what we provide our communities, the safer we're going to be. And always get involved. We have rules that we have to readopt periodically through our Commission of Public Health. And there's plenty of chances for our local health departments to work on a rural work group committee or work on a position statement committee or work on different offerings of food safety trainings that we do. So any chance you see and that you are available to get involved, please do so. Here you see our updated regional environmental health specialist map for the Department of Health and Human Services. These dedicated professionals will be leading our centralized intern training food module for you. They will also be the ones that will walk you through and be the ones to designate you through the authorization process. The highlighted areas and their contact information is located here, and it's located on our website as well. But you will be meeting these great professionals here in our food module shortly. Lastly, I just want to make you aware of our smoke-free ban in restaurants and bars. This became effective in January 2nd. It includes all restaurants and bars in North Carolina, unless it is a private club. This also includes at least 20% of all rooms that are designated for non-smoking and lodging facilities. Complaints that you receive at the local health department should be directed to this website, smokefreencpublichealth.com, where they can fill out all the information on the complaint. This is designated to go back to the local health department. Most of the time it will be environmental health specialists that do visit these facilities, but that would be up to the individual health department's dedicated response team of who replies to these smoke-free complaints in our state. It's been a pleasure speaking with you today. My contact information is here. My email address if you have any questions or concerns or would like some more information in regards to food safety or our regulatory framework in our state. It's shane.smith@dhhs.nc.gov, and my office number is located above. Thank you for your attention. Hope you have a great day.